Leg artery blockage is one of the most common types of vascular blockages we see in society. The reason it does not gain as much importance as heart or carotid artery blockages is that leg artery blockages are generally tolerated. It hurts while walking, but since it does not pose a life-threatening risk and usually does not cause wounds, people tend to neglect it. But leg artery blockage is important for us. Circulation in the legs is just as important as circulation in the heart and brain. If the quality of your leg arteries is not good, they will eventually become blocked and put you in a difficult situation. So how can leg artery blockage be detected? Who should suspect they might have leg artery blockage? In this video, we will talk about this. The number one symptom of leg artery blockage is leg pain. I want to describe leg pain in a few different ways. For example, pain that occurs while walking and goes away with rest. We call this intermittent claudication or claudicatio intermittens. This is the most specific indicator of leg artery blockage for us. But your leg doesn't necessarily have to hurt while walking. You might also get cramps in your leg while walking, or you might have hip pain while walking. In other words, if there is a muscle-related symptom that appears while the legs are in use, unless proven otherwise, our first suspected disease is leg artery blockage. Leg artery blockage can cause pain in your leg while walking. The second most common symptom is feeling cold, chills, and paleness. In leg artery blockage, when the arteries are blocked and blood flow to the legs and feet becomes difficult, our feet will start to feel cold. Coldness in the feet, bluish discoloration, feet becoming cold, and later having difficulty warming up are common symptoms of leg artery blockage. If your legs are cold, turning blue, or becoming pale, your leg arteries may be blocked. The third most common symptom is hair loss. A patient with leg artery blockage will experience hair loss. The nourishment of the hair follicles will be impaired, making it difficult for new hair to grow. The hair will fall out, and since the new hair follicles will not remain viable, new hair will not grow. Therefore, if hair starts falling out in certain areas of your legs for no apparent reason, this could indicate leg artery blockage. The fourth most common symptom is the one that most often frightens us about leg artery blockage. The alarming sign of leg artery blockage is the appearance of sores on the foot. When the feet are deprived of oxygen for a long time, instead of feeling cold, chills, or seeing discoloration, a sore will develop on the leg. If there are sores on the legs, the leg artery blockage must be urgently treated. Non-healing wounds require the immediate opening of the blocked leg arteries. The wounds that appear with leg artery blockage can sometimes make you suspicious. For example, you may have worn shoes. You might have thought that the shoes were rubbing. You may have assumed that the wound developed because the shoe was putting pressure on that area. However, the wound on your leg has actually developed because your leg arteries are blocked and not enough oxygen is reaching that area. Therefore, no matter what, if you develop a wound on your leg, you should definitely have your leg arteries checked. While mentioning the symptoms of leg artery blockage, I would also like to briefly touch on its treatment. Now, we can completely open blocked leg arteries with interventional procedures, entirely without surgery. We generally do not use artificial vessels in the leg. For leg artery blockages, new generation stents, drug-coated balloons, atherectomies, and vessel shaving procedures are used. We have become very proficient at treating leg artery blockages now. If you experience any kind of blockage in your leg arteries, know that we are able to open it. Especially a decrease in your walking distance and the appearance of wounds on your leg are urgent symptoms, and the blocked leg artery should be opened. If you have these symptoms as well, be sure to have your leg arteries checked. For checking, my two biggest recommendations for you are first, the ABI test, and second, ultrasound. The ABI test is the primary test that should be performed to detect leg artery blockages, and we frequently use the ABI test in our clinic as well. If you have been diagnosed with leg artery blockage, you can visit our clinic to get an opinion about opening the blocked arteries in your legs.